Rupinder Appendi is a 35-year-old male. He is stating 8 out of 10 pain, and it's time to give his antibiotics. Morphine is for your pain, ampicillin is your antibiotic. You're first going to check if he has any allergies, and you'll keep that in mind for when you're giving your medications. You are then going to compare your doctor's order to your MAR to make sure they're the same, which they should be. Then we're going to give morphine first. The order is 3 to 5 milligrams. We're going to give 5. So you're going to pull out your monograph. You're going to look for any, are there any contraindications that the client has? Do you have to do any pre-assessments? List some side effects. On the monograph, you're going to check for compatibility with what's currently running. And morphine can be diluted. It will say on there 5 mLs for the half ml. And so we're going to do our first check. So you're going to take your morphine. We're pretending this is morphine. So Rupinder Appendi, morphine, 5 milligrams IV every 2 hours, which is now. So I have my 3 mLs and my needle. I'm going to connect. I'm going to draw back half an ml. The bottle will say 10 milligrams per ml. So we're getting 5 milligrams, so we're giving half an ml. So we're going to swab the top. Got half an ml of air. We're going to instill that and take out half an ml of morphine. I have my half ml. You are going to get her to check the dosage. Now you can do your second check. Morphine, 5 milligrams IV every 2 hours, or PRN, Rupinder Appendi. So now you can dilute it if you want. The monograph says to give this over 5 minutes. This has enough notches. You would give 0.1 every 5 minutes, or every minute for 5 minutes. If you're going to dilute it, you're going to take your pre-filled syringe and you're going to dump 5 mLs of it because you have to dilute it with 5. So you have 5 mLs. You're going to pull back for half a milliliter because that's how much your dose is. You're just going to take your needle just as it is and poke it in and inject. And then you would fill out the sticker that you have to stick on your syringe on this. Whichever you choose, you'd stick it on there. So we have our sticker on our syringe. Now we're going to do our third check. So morphine, 5 milligrams IV every 2 hours, Rupinder Appendi. So now we're going to go into the room with your MAR and your drug. Hand hygiene, put on gloves if you wish. You should, it's best practice. I'm going to ask them their name and their birth date and if they have any allergies. And now we're going to give our drug. So this is their IV. This is what's connected to the patient. This is the closest port. Before you administer any drug, before you start anything with the IV, you need to check the injection port first, like where it is in the hand. You need to make sure there's no swelling or irritation or anything. Make sure the IV is running fluidly. You are going to administer the drug into the closest port to the patient. You are going to clamp the machine. If this is too far, all you simply have to do is kink it here. That's it. The machine will start yelling at you. All you have to do is click stop. If it keeps yelling at you, there is a button on the top right with a bell with an X through it. That silences the alarm. Now, morphine is compatible with what's currently running in my saline, so I don't need to flush. If I needed to flush, I would have taken 2 pre-filled syringes, So I'm going to act as if I did. So this is clamped. I'm going to swab. I'm going to take this off. And I'm going to flush 2 mLs. That's done. The needle would be gone. You don't need the needle. Oops. I'm going to connect. This is my morphine now. And now your timer starts and you're going to give 0.1 ml per minute. Now you don't have to gradually give it over a minute. You can do 0.1 wait, 0.1 wait. Now it's been 5 minutes. I disconnect. I take my second pre-filled syringe. I connect and I flush 2 mLs. I am now done. I can unclamp, start the machine back up, check back in about 15 minutes to make sure it therapeutic effectiveness and any post-assessments. That is giving a push. Now we're going to give the piggyback medication, which is the ampicillin, which is your antibiotic. So the order is for 1 gram IV Q6H. So you're going to make sure you have all your equipment. You got your drug, your needle, your secondary medication set to connect the bag to. You're going to grab your monograph. You're going to start with are there any contraindications? Are there any pre-assessments you need to do? List some side effects. So now we have our monograph. Is it compatible with what is currently running? What do you need to instill this into? So it is a 50 ml bag, I believe, or 100. I believe it's both. What speed do you need to do it at, which is 50 mLs per 20 to 60 minutes. So we are going to do our first check. Take your drug. Ampicillin, Rupinder 1 gram IV every 6 hours. The drug will say ampicillin, 1 gram per 4 ml. It won't have the reconstitution on the bottle. It will be on the monograph. And I believe I did a mini bag plus, so all I had to do was take the bag, peel off the silver, get the spike and connect it with the vial, snap the cord it's connected to, and just pour it in and mix it around and then pour it back. For the just the manual reconstitution of pouring normal saline, just distilled water into it, it will say on the monograph how much it is. I believe it's 250 milligrams per ml. So the vial is 1 gram per 4 mLs. So 250 per 1 ml is the same ratio. So you would just give 4 mLs of the final dose. So we're going to do it that way. So I have my sterile water. That's what it is. I would swab if necessary. I'm going to I don't know what the reconstitution is because I didn't do it that way, but let's just say it's 4 mLs. Whatever it says. So this is a 3 ml syringe, so I'm going to pull back 1 milliliter. Insert that into the vial, get around the edges. Pull back 3 mLs of air. You should do that before you drop the water. Actually, I did that improperly. Get 1 ml, or however much the reconstitution is. And instill that. And take out the 1 ml, or whatever your proper dosing is. I did this improperly, so scoop, and you're just going to roll, or roll it with the Mini Bag Plus. However, make sure when you're using the Mini Bag Plus that you don't just squeeze it in, because it's going to coat it all on the, like, collect it all on the bottom. Kind of try and do it on an angle, that way you're not getting it all stuck on the bottom, and then you're going to take 10 minutes trying to roll it out. Okay, it is now mixed. So I'm going to do, I'm just going to drop the med. So it was 1 gram per 4 milliliters. So I'm going to pull it 4 milliliters. At this point, it'd probably be easier to grab the 5 ml syringe instead of the 3. But because I did the Mini Bag Plus, I didn't go through these steps. So bear with me. Let's pretend I have my proper dose. We're going to take the port. We are going to swab. And we're going to aim for the bullseye. And making sure it's not puncturing the bag. Instilling our drug. That can go right into sharps. We're done with it. Just kind of mix it around. We're going to do our second check. So, Rupinder Appendi, ampicillin, 1 gram IV every 6 hours. You're going to now write out the sticker. You're going to put on the back of the bag. Don't put it on the front. You're going to cover the words. So, we have that written out. We're going to do our third check. Ampicillin, Rupinder Appendi, 1 gram IV every 6 hours. So that's ready to go now. We know that it's a 50 milligram bag for 20 to 60 minutes. So that is going to be our rate we remember for the pump. We're going to take this and our secondary medication set into the room. You're going to introduce yourself, hand hygiene, ask for their name, their birth date, and any allergies. And then you're immediately going to hang this up. Just go ahead and hang it up right then, because we don't need it quite yet. You are then going to open up your little kit of the little tubing. This is going to come out. And you're going to take your main running line, your primary, and you're just going to loop it through. Now this can go over this and hang like that. So I'm going to hang that back up. So that is now hanging. At this point you can stop the pump. All you have to do is click stop, and it may yell at you, but all you have to do is click the silence button on the top right. Now you're going to connect the tubing to this blue port here. Make sure you clamp this tubing before you connect it to the bag, otherwise your drug's gonna run straight out. You're gonna pop that off and instill the spike. So this is clamped, this is connected, nothing is running. You're gonna take the port. Actually, I'm gonna pull this down again. This little clip here, this blue clip is gonna be in the machine like this, or like this, whichever way. This is going to be in the machine. Your drug is before it. So you're going to tell the machine to stop. This is the port you're going to inject the medication into. Now before any of this, you would have checked the IV site to make sure there is no swelling or irritation, to make sure everything's running properly. So this is the port you're going to instill it to. You're going to make sure this is locked. When you connect these two, then you are going to swab this end, take the cap off the secondary, and just connect. now what you're going to do is, this is hanging. Okay, so that is hanging, that is connected, like so, except you can't see. You're going to take your secondary bag and lower it past primary, like down here. There's your primary, here's your secondary, the cord is here. You are then going to release it on the secondary to prime your tubing. That is going to cause it to fill up in your mini bag. That way you know the tube is primed and you don't have to worry about air. You're then going to hang that back up. You are then going to punch into the machine your rate. You just click on secondary, type in how fast you're doing it. This is 50 mLs for 20-60 minutes, so we're just going to go 50 mLs for the hour. And then you put in your volume. You just click volume and then the numbers, and then confirm secondary. Once you do that, it will start running, and you just have to unclamp the secondary. Make sure everything's unclamped. Come back in about 15 minutes to check therapeutic effectiveness and if there are any post-assessments you need done. And that is giving a piggyback.